Hi, this is Dr. Mitchell, and in this video we're going to walk through how to do a two-way repeated measures ANOVA in JASP. So we're going to start off again in our Excel file, and you'll note here that we have two independent variables we're looking at. One is a treatment that we're doing, and so we have one group getting a treatment, another group not. We're calling them the control group. And then we're measuring this variable over time, and here our time is pre and 10 minutes post, and so we're saying pre and 10 minutes for this. Now what's different about obviously two-way repeated measures ANOVA is that our subjects are serving in all groups, and what likely occurred in a design like this is there were two testing sessions. The same subjects came in and did one testing session as the control group, a pre and a 10-minute score was derived. Then they probably came back to the lab a second time. They did a treatment, whatever the treatment was, and then a pre and 10-minute post was done as well. So this is a little different design. It's a totally within subjects design. And it's because of that you'll notice this is formulated a little differently in the CSV file. The subjects obviously are in the rows, and every variable we've measured is going to be in a column. So our pre-control is a column, our pre-treatment's a column, our 10-minute control is a column, and our 10-minute treatment is a column. And the variable here we're measuring is oxygen saturation in the skeletal muscle, in the tissue of the skeletal muscle. So let's open this up in JASP, and I've already done that, so we're just going to pull that up in here, and you'll notice the data is exactly the same. And like other ANOVAs, we're going to go to ANOVA, and we're going to go to a repeated measures ANOVA for this one. So we go to our repeated measures. Now, it's going to ask me, okay, what are the variables that are repeated? Well, both of them are repeated. Time, right, which is our pre versus 10-minute, and our treatment. Because again, although the treatment itself isn't time, it was measured in the same groups. So we're going to call that a repeated measures factor. So we'll call one of these factors, we'll just call it treatment. We'll spell that out there. And then obviously we have our control group and we have our treatment group. But we also had a repeated factor of time, right? And obviously in this we had pre, and then we had our 10-minute value as well. And you'll notice as I'm typing these in, JASP is automatically going to preload cells here for me to put my data in. So let's try to fill these in. We need our control pre, that's right there, so we're going to throw that into that cell. We need our control 10-minute, which is right there, so we'll throw that in. We next need our pre and treatment, that's right there, we'll throw that in there. And lastly, we have our treatment in 10-minute. That's our last one, and we'll throw that in there. Now, if for some reason we had a between subjects factor we wanted to look at, we could throw that in here as well. But again, this is a completely within subjects ANOVA, so we don't have a between subjects variable for this analysis. And you'll notice immediately as we look into this that we get our ANOVA table. And again, you'll notice both our main effects and our interaction are all in the within subjects area of the ANOVA table, because again, this is a within subjects repeated measures ANOVA. So you'll notice quite quickly our treatment has a p-value of 0.353, so if we're using alpha level of 0.05, that's not significant. Our treatment over time is for both groups, and most importantly, our interaction is significant. That's 0.09. And if we wanted to look at a plot of this, which we could do really quickly just to get an idea of what this looks like on a graph, we'll put our time on the horizontal axis, we'll do our treatment in separate lines, and we can immediately see that, yeah, there's definitely a difference in how these groups respond in their muscle saturation over time, which is good. That's what we would hope for, right, when it comes to utilizing in a practical way some treatment. Okay, so let's go back to some of our ANOVA table, some things we can also do here. A lot of this will be similar to what we did in previous ANOVAs. We can include our descriptive statistics, our estimates of effect size right there. We can include those. If we want to do some assumption checks, we can do that in ANOVAs. Now in ANOVAs, To note here, what we usually do is a greenhouse geyser is a very common one. And what this will do is if there's any issues with normality of data, it will make corrections for that. However, there isn't in this data set, and so it chooses not to correct that. In some software packages, it'll just make a slight variation to the p-value. If there's any issues with the greenhouse geyser there aren't. We'll do some homogeneity tests as well, just to include those if we so choose. And so we have a lot of options here. Now, obviously, like previous ANOVAs, we can also do some post hoc tests. So we'll scroll down to our post hoc tests. We'll include our treatment because that's really what we want to know here. And as we scroll down, we'll see our post hoc comparisons, and we can identify where exactly those are. We can include our confidence intervals for those if need be, and really specify where these differences are. Like previous ANOVAs, we have options for post hoc corrections. JASP uses a home. Obviously, you can use a Bonferroni, a Tukey, a chef. All of these are available to you, and you'll note the p-value alters slightly. We also can do descriptive plots, just like we did with descriptive data. We have some options there for us as well. I won't go through all of those. We can do some of our rain cloud plots, a density plot, a box plot if we so chose. So again, a lot of the same options that we have seen here previously. So I hope this helps in you doing a two-way repeated measures ANOVA, and we'll see you in the next video.